Carolina. Well, that's also the national statistics. 1 in 3 children are overweight or obese in this country. In the populations that Frank was talking about, let's say in the Hispanic population and Native American populations, 1 in 3 children are obese or overweight before the age of 5. So we have an epidemic that is growing. We have other statistics that are even more alarming and very important when we talk about the healthcare industry. Right now we have 20 million diabetics. We are projected to have 80 million diabetics. So the healthcare costs to businesses, to federal agencies, to state governments, to city governments is just enormous of what's happening in this country. And we spend right now about $147 billion on obesity-related healthcare costs. So I believe that you all are the solution for some of these healthcare costs and how we can do something about it. People ask. When I was at the White House, we did tours often for reporters and other things, and we have a White House garden that the first lady started. And I'll never forget that we had a bunch of journalists coming from all over the world, and they said, well, you know, your obesity problem that you have in the United States, if you just got rid of Coca-Cola and got rid of McDonald's, then your problem would be solved. And really, when you think about it, that's not the only answer. There's no silver bullet. It can't just be one thing. I think about how I grew up. Andrew was asking how you spent your day when you were younger. But I think about other things, how things have changed. So when I grew up in New York City in the 1960s and 70s. And so I walked to school, and I was, in the 60s and 70s, 70% of kids walked or biked to school. We have changed that now. That 70, it's the exact opposite. 70% are either in cars or in school buses. Back in those days, I remember I couldn't wait for Saturday mornings that I could watch more cartoons. And my mom would let me watch the cartoons, but the moment Soul Train came on, you know, I was out of the house. I was kicked out of the house, and I could not come back until sundown. It's changed now. We have 24-hour cartoon networks, Nickelodeon, we have DS's, Playboxes, Wii's, all this kind of stuff that is happening in our children's lives and our adult lives. So we have all these different competitions. And as a mom, I could say, I think about what happens to me every single weekend is I have a lot of stuff to do. And I have some things for my kids to do, whether they have a soccer game or a baseball game, or maybe we'll go skiing one day, but they are so programmed to be entertained all the time. They don't know what to do to just sit. Being bored is so hard for these kids. They're like, Mom, I'm bored. What am I going to do now? What are we going to do now? And so as a mom, I did it last weekend, last Sunday. I'm like, not my job to entertain you, figure it out. What you realize is what you all offer in the outdoors. As a mom, when I go to a website and I say, oh, what are the 10 top things to do in Washington, D.C., almost everything is inside. Is go to the Air and Space Museum, go to things. So the top attractions, nothing is the outside. Nothing is going outdoors. So somehow, with what we're doing collectively, we have to figure out how, and I would say for parents, if we're really going to target youth, is how to make it easy that I have that one-stop shopping. It's the consumer to figure out what to do on the weekends, because I gladly use some ideas to entertain the boys. So I think when we have crisis, we also have opportunities. And we think about, and the big thing, again, mentioning why you are part of the healthcare crisis. If you think about what happened in the 1800s and the 1900s, we had major public health care crisis. We had tuberculosis. We had the plague hundreds of centuries ago, but every time there was a major health crisis, it wasn't the Department of Health who fixed it. They didn't fix it. Maybe they talked about it and they had the statistics, but it was usually the Department of Public Works. So all of a sudden we had sanitation. We had irrigation and maybe some clean drinking water. So I would surmise that it's the same thing, is that when we look forward to the future of solving the obesity crisis and diabetic crisis and our healthcare crisis, is that we have to look outside the Department of Health to solve this problem. And the Department of Health needs partners. They can't do it alone. So there's some interesting things happening of opportunities, and just wanted to share some of them with you. Is that one, I had this great opportunity when I was with the First Lady. We went to the largest Army training base, it's actually almost a year ago, I guess it was Jackson, South Carolina, run by General Hertling, and General Hertling ran all the 69 Army training bases. And what they found at the Army training bases is the Army and the military is really a great microcosm of what's happening to our youth around this country. And what they found was that these Army recruits, when they started their basic training, they would start their day with maybe a donut or a bagel, and then when they got to the wall, the climbing wall, after about an hour and a half, they had no idea why they couldn't climb that wall. They had no concept of what they had put in their body didn't give them enough energy to climb the wall. What they also found, because the Army likes to do lots of statistics, is the same kids that are 18 and 19 years old now are the same kids that when we started cutting physical education in schools, so they have less bone density and they're having more bone fractures and problems that we all end up paying for. So they started a program that they initially called the Healthy Soldier. Well, that kind of fell flat because no one really wants to think of themselves as a healthy soldier, but they transferred the name, they changed the name, did some messaging and market research, I'm sure, that they call it now Fueling the Soldier Athlete. And so now they are all tactical athletes. So they do in the lunchroom, what I do with my kids every day at the dinner table is they have a green light, the all-the-time food. They have the yellow light is the sometime food, and the red light, like, not so often food. So they are retraining them how to eat, and they're retraining with PE. And so out of a crisis is an opportunity where they're taking a whole bunch of people and retraining them. You have another from the private sector, a great example, I don't know if you've all heard about this, is that United Healthcare has partnered with the YMCA for a diabetes prevention project. Now, United Healthcare, as you probably, I don't know if you all know, they have over 70 million subscribers. So what they found was that they, 40% of their claims are either from their diabetic or pre-diabetic subscribers. So just think about that. They have a big dashboard that shows. So they realize that if they don't do something about their pre-diabetic patients, they're going to go bankrupt. So they partnered with the Y, and they reimbursed the Y, not doctors, not nurses, but fitness instructors. They reimbursed the Y for a 16-week program on diabetes prevention. So to me, that's an incredible opportunity, and when we look at what's happening with the Affordable Care Act and what's happening with healthcare costs in this country, is that who are the other workers of the future? Who are the other people in the future? And maybe it's people in the parks that become the next prevention workforce. Who's the workforce so that we stay healthy, so our healthcare costs are down? Because healthcare costs are driving everything in so many businesses and what's happening in counties. So when we think about the outdoors as America's medicine, I kind of want to reiterate what was said both by Frank and by Jason, is that we need to make it easy and we need to make it fun. So if I'm a mom, it should be really easy, but it also should be really fun. I'm sure you all know about the America's Great Outdoors report. And when they did the focus groups with a bunch of the kids, one of the things that came back, which I thought was really great, was they said, one, don't call it exercise. And don't call it healthy. You know, you have to do something that you have to make it fun, so that it's fun going out there, that they're not like, oh, I'm trudging up the hill. I think about when I go hiking with my husband is like, he always wants to get to the top of the hill as fast as he can. Well, you know, he's in his 40s and he's really strong. I've got the 6 and 9-year-old, and so when I go hiking, we make it fun. We're like, oh, look at that rock, or we found a snake. You know, we'll never get to the top, but we try to make it fun. And so everything that we do is how do we make it easy and how do we make it fun? The big thing that was also talked about was, and I'll just reiterating, is message and communications. And I'll tell you a little story that I heard about a long time ago when I was doing some consulting that I used to call the frog story. So there was a consulting group, an environmental group I should say, in the San Francisco Bay Area that was trying to fight the new runway that was coming in San Francisco because of a frog. There was an endangered frog, and they wanted to make sure that they preserved the frog. So they contracted with this agency to say, how can we save the frog? So the agency did some research, and they found that people in the area were worried with the runway, worried about noise pollution, worried about air pollution, worried about traffic congestion. So the consulting group goes back to the environmental group and says, okay, we know how to save the frog. We'll do a campaign based on noise pollution, air pollution, and traffic congestion. And the environmental group says, well, we want them to do it for the frog. And so you realize for messaging, for all of us, we may care about the outdoors because we grew up in the outdoors, but a lot of other people haven't. So when we figure out our messaging, it has to be based on their values. Whether it's Hispanic audiences, what Frank was talking about, and an extended family. So when we develop these messages of trying to get people outdoors, we got to figure out what our audience cares about. So that's one of the things that we did at Let's Move. When I was at Let's Move, really the thing that I got back from a lot of the federal agencies, which was just heartening, is we worked with 12 federal agencies, and Let's Move was like an umbrella. So I would have people from the Food and Nutrition Service. I don't know if you've ever heard of the Food and Nutrition Service. They do the school lunch program, they do food stamps, they do all the food assistance, federal food programs, and they're out there all around the country. And they said, you know, we go around the country and no one really cares what we do, but when we say we're part of Let's Move, all of a sudden somebody wants to talk to us. So having that umbrella language of Let's Move really helped the federal agencies that were in the field to talk about they're part of something bigger and they're part of some type of collaborative working together to solve a problem. And so that was, I think, one of the biggest things, and is one of the biggest things of the popularity of Let's Move. We also created some sub-initiatives so people could tailor things. So while I was there, I worked with the Department of Interior and we created Let's Move in Indian Country. And so then we worked with lots of different partners and tribes on that so you could tailor it for the messages that would work in Indian country. We also worked with nonprofits to create something, and some foundations to create Let's Move Childcare. We had some standards of what makes a good, healthy childcare center, and if you ticked off those kind of standards, you could say you're a Let's Move Childcare Center, and so people would feel like they're part of something bigger. It's something also, Let's Move Faith in Communities. Faith leaders are an important, really important aspect to this effort of being healthier and reach a ton of people every single week. And so we worked with them, and the campaign continues to work with faith leaders that your body is your temple and that we need to help people be healthy. So trying to figure out in the messaging of being something bigger or something that everybody can be part of, and just looking at what Jason had of the different agencies. When you think of the consumer aspect, when I'm a mom or I'm a kid, I don't care if you're the Fish and Wildlife Service or Take Me Fishing or the Forest Service or BLM or the Park Service. From a consumer, I just want to go have fun and do something outside. So how can you all cross-pollinate more and work together so as an end user, I don't really have to differentiate working with all the different agencies, because most people don't even know. They don't know the difference between the Forest Service and the Park Service and the Fish and Wildlife and BLM, unless they're really into it. But you know, an average kid is not going to know that. And I'll just share another thing about messaging. Just recently at the Partnership for a Healthy America, which is the business partnership side of Let's Move, there's an organization called Childhood Obesity 180. And they announced this messaging component with all the after-school groups. So the after-school groups, so think of Boy Scouts, Girl Scouts, YMCA, Jewish community centers, you know, anything that you can think of, they are all going to say the same three things. And the three things are drink smart, so choose water over sugar-sweetened beverages, be active, get 60 minutes of physical activity a day, and then limit your screen time. So can you imagine as a kid, I'm in the Boy Scouts, and then I go to my after-school program, and